Good morning, everyone. Welcome and thank you for joining us for the next in the series of Cigna's Connect for Health webinars. My name is Alison Sharp and I'm the Director of Client Management for Cigna in the Middle East. In our last session, we talked a lot about women's health, so it's only natural that we now turn our attention to men. In most parts of the world, health outcomes amongst men continue to be considerably worse than among women, and this is an issue which is often largely overlooked. The global impact and it's had on many of our lives, turning it upside down, has been tough, and we recognise this. But at Cigna, we also see this as an opportunity for positive change. While many of us are getting used to connecting virtually, we want to connect with as many of you as possible. Today, we want to encourage men to be proactive about their health, which is why we've asked one of our experts to come today to talk about those challenges and how to get through them. We are in the middle of an extremely unusual and sometimes difficult period of time, but while you're trying to juggle everything, it's really important not to neglect your health. You should be aware of the health problems that typically affect your age group and your gender group. As your health and wellbeing partner, we are here to help you better understand what those are and what you should be looking out for. Today's session is entitled Challenges and Opportunities for Men's Health in the Coming Decade. We'll explore the current status of men's health, as well as taking a look into the future. We'll also be taking an exciting look into the world of robotic technology within healthcare. I'd like to introduce you to Dr. Muhtar, a renowned endourologist and robotic surgeon with over 15 years of experience in the field. He specialises in looking after patients with urological and prostate health issues. As always, we encourage you to make the most of the session. Please ask as many questions as you can. You can do so by using the question tab at the right-hand side of your screen, and we've allocated time at the end to go through those questions. Thank you. Over to you, Dr. Muhtar.
Good morning, everyone, and thank you very much for the invitation to be a part of raising awareness for men's health during the month of November. Let's see what we're going to start with. In men's health, I'm going to talk about four main subjects. The first one will be prostate cancer, then talking about prostate enlargement, testis cancer, and lastly, we'll talk about erectile dysfunction and testosterone deficiency in men. Starting with prostate cancer. Prostate cancer is the second most frequent cancer diagnosed in men, and it's the fifth leading cause of cancer death in men. It's the most common cause of death in Swedish men, and I choose Sweden because I trained and worked in Sweden in the last 17 years, where the incidence is very high, 10,000 new cases every year, with a death rate of 2,500 persons a year. And if we're looking across the United Kingdom, which is one of the largest countries in Europe, you see the prostate cancer is the most commonly diagnosed cancer. More than 47,000 men are diagnosed with prostate cancer every year. That's mean that 129 men every day, every 45 minutes in the UK, one man dies from prostate cancer. It's almost up to more than 11,000 deaths per year from prostate cancer, and in 8 men will be diagnosed with prostate cancer in their lifetime in the UK. That's mean that's around 400,000 men are living with and after with prostate cancer in the UK. What's the prostate? Prostate is a gland that's found in men in the pelvis, just in front of the rectum. This is the rectum, this is the prostate, where the urethra going through the prostate inside the bladder, the urinary bladder. And what is prostate cancer? Prostate cancer is a malignant tumor of the prostate. It's abnormal growth of the cells of the prostate. You're looking at the graph there to the left. This is the normal cells of the prostate, and we abnormal growth of the cells. And when the abnormal growth breaching out the prostate, they can spread to the rest of the body. The role of the hormones in the prostate cancer, there is a role related to male sex hormones, which calls androgens. Testosterone is the most important androgen, and androgen are almost exclusively produced in the testicles, and in 5% of the cases that can be produced by the adrenal glands. Risk factors for prostate cancer, of course, age is the main risk factor. Men above the age of 50 or 60 have increased risk of prostate cancer. Family history is something that one of the risk factors. Men of African descent has increased risk. African Americans seem to be increased risk of prostate cancer and presenting with more aggressive prostate cancer. Smoking and obesity, of course. Symptoms, prostate cancer generally asymptomatic. In most cases, if there's any symptoms, it may be caused by the prostate enlargement or infection. These symptoms may include urinary symptoms that are frequency, weak stream of urine, blood in urine, erection problems, urinary incontinence, loss of bowel control, pain in the hips and back and chest or legs, or weak legs could be presenting symptoms for prostate cancer. How can we diagnose prostate cancer? Of course, PSA testing. PSA is a prostatic specific antigen produced by the prostate. It is one of the most frequently used tools. If the PSA level is too high, this suggests that the cells of the prostate are behaving unusually. That doesn't mean that you have a cancer, but there is something suspicious. This could be because of a tumor in the prostate, but also because of infection or a benign enlargement of the prostate. And beside the PSA testing, the digital rectal examination by putting the finger inside the rectum to feel how the prostate feel. And then we can complete everything with the imaging. We may do an ultrasound, may do a CT scan, an MRI scan, and bone scan. But regarding these imagings, actually none of these tools, imaging tools, will provide a definitive answer on whether or not you have a prostate cancer. How we can, before we go into treatment, actually, so this high index of suspicion made that we need to take a biopsy, some tissues from the prostate to make the diagnosis, and then we have to decide how we treat the prostate cancer. Which treatment pathway is the best depend, of course, on the tumor characteristics, on your medical history, your age, the kind of treatment available at your hospital or your country, your personal preferences or values, and the support network available to you. So it's a patient-tailored approach. There's no size fit for all. It is a multimodal treatment. It's a multi-component treatment. There's many self-management strategies and a symptoms-based approach. Treatment could be a conservative treatment. Many cancers or low-risk cancers can be managed conservatively by just follow up and treat when the disease progressed. Radical prostatectomy, operating and taking out the whole prostate, either with open surgery or robotic surgery, giving some radiation therapy while keeping the prostate in place, and then in some cases where the disease is disseminated, then hormonal treatment is the treatment of choice. Talking a little bit about robotic surgery, which is my field of experience and expertise, the robot has been introduced to the field of prostate surgery and urology already. Soon, 20 years ago, we performed the second procedure in Europe at the year of 2001 and in my center in Stockholm in Sweden. The robot allowed us to have a much higher precision. You have a 3-dimensional imaging. You can move your hand as seen in the pictures, exactly what you can do outside the body, which is not possible by the conventional keyhole or so-called laparoscopic surgery. So very high precision, very much better imaging, resulting in better results. And of course, one of the results of robotic surgery, because it's a minimal invasive surgery, we have a better precision in surgery. Patients experience much less pain, much less bleeding, very shorter hospital stays, almost 90% of the prostate cancer surgeries patients discharged the day after, lower risk of infection, much faster recovery, and of course, we don't need to forget the surgeon. We have better ergonomy for the surgeon during these surgeries. Of course, multiple studies highlighted that unless the condition is unbearable for men, so men are up to 50 to 60% less likely to regularly see a doctor compared to a woman. There is, of course, something behind this. Yeah, some men try to find excuses. I'm too busy, afraid to find something out, might be seriously wrong, fear or discomfort of the prostate exam. These are just some of the excuses that men commonly report for not visiting a urologist. So, the question that raised by many, can you reduce your risk for prostate cancer? Actually, no one knows how to prevent prostate cancer, but staying a healthy weight may be important because we've seen that obesity was one of the risk factors for the prostate cancer. Eating healthy, balanced diet and keeping physically active is very important. It's not for only the prostate, it's for your heart and for your body. Unfortunately, we cannot change our age, ethnicity, or family history, but we can, of course, take control of our diet and weight. And looking if you can read and hear a lot about foods, if they can lower your risk for prostate cancer, actually, there is no strong evidence that any individual food can do it. There is many publications about lycopene, which is found in tomato and tomato products, selenium, vitamin E. But again, there is no strong evidence that any individual food can do it to lower your risk for prostate cancer. Going further to the next topic, the benign prostatic enlargement. This is a common condition above the age of 50. It is almost related to hormonal changes because the prostate diseases can be very worrying, but it is important to know that the benign prostatic enlargement is not a prostate cancer. And benign prostate enlargement doesn't become a prostate cancer, even if it is left untreated. There's different type of symptoms with benign prostatic enlargement. Symptoms related to the way you hold the urine in the bladder, and this is called the storage symptoms. There's symptoms related to the way you urinate, called voiding symptoms, and symptoms related how you feel after you urinate, and it's called post-micturition symptoms. Looking at the storage symptoms, yes, you need to urinate more often than usual. You need to wake up at night to urinate, and the sudden need to urinate and having trouble holding it, and any involuntary loss of urine, which is called incontinence. Looking at the voiding symptoms, weak stream of urine, splitting or spraying of the urine stream, the flow of urine start and stops intermittently, straining when urinating. It takes a while before the urinary flow starts, and it takes longer to finish urinating. In rare cases, there is an acute or chronic urinary retention, that's say inability to empty the bladder at all. Looking at the post-micturition symptoms, they feel that the bladder is not completely empty, involuntary loss or dribbling of urine into your underwear, and shortly after leaving the toilet. How we diagnose benign prostatic enlargement? Of course, as the other diseases, we need to have a detailed medical history, physical examination, taking urine tests. Sometimes we need to do blood test, blood diary, something called uroflowmetry, and sometimes imaging of the urinary tract is needed. Uroflowmetry, this is where when you can measuring the urine flow rate at home, and if you can see, you can measure how much you're emptying during the first 10 seconds. And at the hospital, a common type of uroflowmetry container for men and women that you are peeing in this machine, and you get a curve for your urination to determine whether you have an obstruction or not. Treatment options for benign prostatic enlargement, of course, watchful waiting. We don't need to treat. I'm going to talk about more soon. Lifestyle advice, self-management, and lastly, of course, drug treatment and surgical treatment. Talking about watchful waiting. Watchful waiting is a very good option if your symptoms are mild or moderate and if you feel that your quality of life hasn't declined. That's why if you have some symptoms but it's not serious, then we don't actually need to treat it. Despite how it may feel, this is not a passive approach because it includes regular checkups to make sure that the condition doesn't get worse and not to miss other conditions during the follow-up. Lifestyle advices is a very good thing for maybe all the men. You have to drink at least 1 liter every day. Drink more if you live in a hot climate or do a lot of physical exercise. Drink less before and during long trips. Drink less in the evening. Men who are experiencing peeing during the night have to drink less after the 6 o'clock in the evening. You have to avoid alcohol and caffeine. Try to exercise at least 2 to 3 times a week because lack of movement can make it more difficult to urinate and cause urinary retention. If you go swimming, bring an extra set of dry clothes and change as soon as you are out of the water because dampness and cold may increase the need to urinate and can cause urinary infections. Sometimes urine sprays and it can wet the toilet seat or the bathroom floor. Some men prefer to sit down when urinating, of course, to avoid this, while others prefer to urinate in a cup and empty it in the toilet. Looking at the drug treatment, of course, there's many factors that can influence the decision if we need to treat and which method of treatment. Of course, your symptoms, the size of the prostate, your medical history, which drugs are available in your country, and of course, your personal preferences and values. There are several groups of drugs that can treat the symptoms caused by benign prostatic enlargement, and these just to mention some of the drugs. The alpha blockers as the most commonly used drugs, which make the bladder, neck, and the prostate relaxing. It would easier to urinate, and then the 5-alpha reductase inhibitors, they make the prostate to shrink in about 20 to 25% and make the emptying of the bladder much easier. Going further to the next slide, the surgical treatment. Again, it's just like the medical treatment. What factors can affect the decision making for it? It's the size of your prostate, it's your medical history, the kind of treatment available at your hospital, and the expertise of your doctor, your personal preferences and values. And of course, there is no single treatment which is ideal for all patients. This is why we have a tailored approach, a personalized approach for every patient to choose the right treatment for that patient. When surgery should be considered, yes, it is when your symptoms get worse, even if you are already receiving drug treatment, or when you have a complication of this enlargement, or you are at risk of getting them. Complications like kidney failure, the renal function will be impaired, the dilatation of the kidneys, inability to urinate, called urinary retention, totally stopped urination, recurring urinary tract infections, and recurring blood in the urine, and sometimes stones in the bladder because of the obstruction. And if you don't tolerate drug treatment very well, and of course, if you prefer surgery over the drug treatment. Going to the third topic, testicular cancer. Just to talk about the testicles, it's also called the testis, as a part of the male reproductive system. They are found in the scrotum, which is the pouch of the skin that hangs below the penis. The testicles make testosterone and sperm. 95% of the testosterone is produced from the testicles. What are the risk factors for testicular cancer? It is commonly in the age between 18 and 35 years. If you have a history of undescended testicle, in the past or the present, you're in increased risk of testicular cancer. Opening of the urine on the underside of the penis instead of the tip, hypospadia, this situation called. Poor sperm production that makes it difficult getting a partner pregnant. Abnormal testicular development. If you have any family history of testicular cancer, and if you are of a white race, then you have a risk factor of developing testicular cancer. What are the symptoms of testicular cancer? As testicular cancer grows, you might feel a lump or swelling in a part of the testicle. This is the most common presenting symptoms in patients with testicular cancer. You might have a pain in the testicle or the scrotum, but testicular cancer is usually not painful. Something to remember, most lumps are not cancers in the testis. There are many other conditions that can be presented as lumps. So remember, most lumps are not cancers in the testicles. What tests are available to do for testicular cancer? Blood tests to check the high levels of certain proteins that can suggest some testicular cancers. These are called tumor markers. Ultrasound is the diagnostic way for testicular cancer. Sound waves are used to view the inside of the testicles, including any growths. Biopsy, it's very unusual to take a biopsy because ultrasound in majority of the cases will be enough to make the diagnosis. And in special cases, the MRI, the magnetic resonance imaging, is maybe given additional help to make the diagnosis. Of course, one of the important things that many men and young men are not aware about, examining the testicle. It's very easy to do it, and during in the bathroom, look for the swelling in the scrotum. You can gently feel the scrotal sac to find a testicle, and you can examine the testicle one at a time, firmly and gently feel the testicle between the thumb and the fingers of the both hands over the whole surface. So if you find a lump, a swelling, or other change, see your doctor. Changes, as I said, are not always cancer, but if it is a cancer and you catch it up earlier, you have the best chance for cure, because testis cancer is one of the most curable cancers between other cancers. How is testicular cancer treated? It's mainly surgical. The testis must be removed to remove the cancer, and it can be made through incision in the groin and removing the whole testis and the cord. Sometimes additional surgery, some drug treatment, chemotherapy, or radiation therapy also may be needed in a later stage, but still the survival rates of early detected testicular cancer, the 5-year survival rate is up to 99% of the cases. Last topic, erectile dysfunction. Of course, erectile dysfunction is a common male sexual disorder. It's more common than we expecting. It is inability to get or keep an erection that allows for satisfying sexual activity. It can happen occasionally or regularly with or without any clear reasons. Some men with erectile dysfunction are not able to get erection at all. ED, of course, is a not life-threatening disorder, but it can have a negative impact on your quality of life and that on your partner. What are the risk factors for erectile dysfunction? It's actually almost the same that the risk factor for cardiovascular diseases. You have a stress, anxiety, depression, obesity, smoking, lack of exercise, alcohol abuse, diabetes, heart diseases, high blood pressure, neurological diseases, vascular diseases, high cholesterol, and of course, relationship problems. Cardiovascular diseases and erectile dysfunction. This is very important because erectile dysfunction can be an early sign of heart disease because problems with blood flow affect erectile function. This is why men who experience erectile dysfunction should go to the doctor to get checked for heart diseases. This is very important because previously this was neglected by many men, and then of course it could be an early sign of a heart disease that discovered later on. There are many psychological risk factors for erectile dysfunction. We are uh, living in a stressful world that we put many demands on ourselves. So there are several psychological conditions have been associated with erectile dysfunction: anxiety, depression, feeling of self inadequacy, low self-esteem, inability to describe emotions, stress, social ideas in some cultures of how men and women are supposed to interact and can also contribute to erectile dysfunction. These can include unrealistic expectations about love and sexuality and inappropriate male and female role models. Erectile dysfunction is something that causes and sometimes the result of unsatisfying or, of course, dysfunctional relationship. Few words about the testosterone. The testosterone is the male sexual hormone, is the most important hormone for male. You can see at the age of 20, the body is full with the testosterone hormone, and with the age, the amount of testosterone will decrease, and almost you see at the age of 90, the amount of testosterone are tiny and decreased very, very much. And of course, testosterone as a hormone, why it's important? Because it's work almost on every place in your body. It works on your brain, on muscles, on the skin, on the liver, on the fat, on your bones, on your kidneys, on, of course, on your male sexual organs and your bone marrow. And you can look at this nice slide, show the differences in a man with a low testosterone and a man with a high testosterone. You can see easily man with a low testosterone suffering from depression, from lack of focus, from constant fatigue, from developing gynecomastia or man bulbs, decreased in the muscle mass, increasing the abdominal fat, and low libido and erectile dysfunction, and of course decrease in athletic performance. One very important thing, recognizing and preventing men's health problem is not just a man's issue, because it's of impact on wives, mothers, daughters, and sisters. Men's health are truly a family issue. This is very important to everyone to remember. This is a truly family issue. And this was my last slide. Wish you all to stay healthy, and we're welcome with your questions.
Hi, Doctor.
Hi, how are you?
Good, thank you. Thank you very much for that session. We've had a lot of questions coming through. So I'm going to start with, where in Abu Dhabi should I go to have a PSI screening?
Actually, in every hospital, you can go and get a PSA screening. It's available everywhere.
Okay, great. I know you talked some earlier on about the symptoms, but there's been a question that maybe you could go over them. So can you lay some more importance on self-diagnosis on prostate, and perhaps some symptoms that will help us identify?
Well, as I said, the prostate cancer is asymptomatic in majority of the patient. This is why the regular checkup after the age of 50 with a PSA may help us for the diagnosis, because most of the symptoms are related to the enlargement of the prostate.
Okay. Earlier in your presentation, you talked about some of the myths about like tomatoes and certain foods being able to kind of help prevent these things. A question has come in to ask, are there some multivitamins available for the prostate? And are they any good for enlargement or cancer prevention?
Well, the short answer is no, because there is no strong evidence that any type of food or multivitamins or any supplements can reduce the risk for prostate cancer. So stay healthy food, healthy lifestyle is the most important thing.
Mm-hmm. We have a question here on sports. So, does cycling regularly have a bad impact on your prostate, be it cancer or enlargement?
Actually not, but sometimes for the professional cyclists, it can have impact on erectile dysfunction, because some of professional cyclists, after a long racings, they may experience erectile dysfunction for a while because the pressure from inside to the prostate.
Mm-hmm. Okay, but not so much on enlargement or cancer related. What is the name of the drug that can make the prostate shrink, please?
It's the generic name is 5-alpha reductase inhibitors, and it's called the drug available in the name of Proscar, or finasteride, or dutasteride.
And I imagine that's prescription only drugs. You would need to go to a doctor about these things.
There are some herbal medicines there, but again, there's no much evidence that they may help.
Okay. Do you recommend a PSA test for men older than 50 with no symptoms or family history of prostate cancer?
Well, actually, there is a great discussion whether a screening is very useful in prostate cancer, because again, the something specific with prostate cancer is a slowly growing cancer, and many of the cancers maybe we don't need to discover them because it will not bother the patient. So actually, at least once, yes, men after the age of 50 should check the prostate and the PSA, and then decide after that whether there is any need of regular checkup or just fine with the one checkup.
Mm-hmm. A question's come in. Would a usual ultrasound check with your urologist reveal any abnormalities, cancer for the prostate or testes?
For the testes, yes, but for the prostate, it can reveal enlargement of the prostate, but it's usually you cannot see the cancer with ultrasound. But it's a combination of digital rectal examination where you feel the prostate, the PSA, and ultrasound give us a picture whether there is a suspicion of cancer or not.
Can you talk about treatment options for erectile dysfunction?
And there are many treatment options, from drugs to surgeries. There's many drugs that, of course, everything depends on the cause of the erectile dysfunction, because some causes can be only treated when it's stress and anxiety treated by the patient, and the healthy lifestyle, stop smoking, start training. And sometimes the deficiency of testosterone can be treated by the replacement with the testosterone. There are some medications that can help for the erection, and some people can get some surgeries to get implant in the penis for the erectile dysfunction. Everything depends on the cause of the erectile dysfunction.
We talked earlier on about robotic surgery, and that's something that you do yourself. There's a question about how widely available is that in the UAE, or is it, again, really specific to people like yourself?
It is available in the UAE. We have a robot at Mediclinic City Hospital in Dubai, and I think it's available in 2 or 3 other places in the UAE.
Okay, good. A question's come in more for Cigna. So does Cigna cover these tests? If you have any signs or symptoms which are prompting a test, then yes, they would be covered under your policy. You may also have an additional wellness plan. So you want to check your member booklet and it'll tell you if you have that. And if so, that's your preventative checkups. So if signs and symptoms, yes, always covered. But you may actually have the option to do preventative checks. So if you have a look at your member booklet, it will give you some guidance on that. A question about surgery. So what are the risks associated with surgery for enlarged prostate?
Well, it depends on the type of the surgery. The conventional surgery where you are resecting the prostate, the risk are some of risk of any surgery such bleeding, infections, and the main risk is the so-called retrograde ejaculation, that when the main ejaculate, the sperm will go inside the bladder and not outside. This is why such type of surgeries are not recommended for younger men who are trying to have children, but otherwise has almost no impact on the sexual life.
Mm-hmm. Is there anything men can do now other than living a generally healthy lifestyle to avoid urinary issues at an older age?
Well, it's very, very difficult. There is no evidence that any other things can help. Just stay healthy. The healthy lifestyle is the most important thing.
Mm-hmm. A question has come in about the testosterone levels. Are there any ways to healthily maintain testosterone as you get older?
Well, physical activity and keeping the weight and keeping in a good shape is the most important thing, because with obesity, the testosterone will decrease.
Okay. How to manage the risk of renal failure in a patient who has past history of kidney stones and recently diagnosed with benign prostate hyperplasia?
Can I repeat the question?
Yeah, so it's a question about how to manage the risk of renal failure in a patient who has the history of kidney stones and has recently been diagnosed with benign prostate hyperplasia.
Well, the best way is to treat or to try to have a checkup for the prostate enlargement, because the prostate enlargement, if it affects the emptying of the bladder, you can have a urine in the bladder, and this will affect the renal function. And of course, the recurrent stone formation will contribute also. So it's regular checkup will probably decrease the risk for renal impairment.
Mm-hmm. You talked earlier on at the very beginning of your presentation about the links between certain kind of nationalities and backgrounds. There's a question come in just about that topic. So what is the link between African descent and high chances of getting prostate cancer?
Well, actually, nobody knows. Just they noticed that the African American have increased risk, but it's most probably something genetic. But we don't have a clear answer about it.
Mm-hmm. And very earlier on in the presentation, you talked about the excuses that people use not to come for tests, and I think that's the same for women. There's a lot of reasons why we would be uncomfortable going for tests. What would you say to make someone feel better about coming for one of the tests that you do?
Well, because knowing the risk that if you are not going to for checkup or test, maybe helpful for many people to make them overcome the fear of seeing a doctor for checkup. And I think that's the easier thing. Women are much easier to talk to each other. The men are the fear and afraid to talk to each other about these conditions, because they're usually linked for they're afraid of the their sexual life should not be revealed, or if they have any problems. So I think men need to talk to each other, may need some clubs to discuss these things, and not to be afraid to go for the checkup.
Yeah, because the topics that you mentioned seem to affect a lot of different men and a lot of different age groups. So what you're saying is you encourage men to speak to each other about these things, talk to friends, and then go for the tests, because the risk of not going is too great.
Exactly.
I have a question here. I'm going to make sure I say this correctly. So what are the pros and cons of transurethral resection of the prostate surgery? Very specific question.
Transurethral resection of the prostate is still the gold standard for the treatment of prostate enlargement. The pros, of course, you get rid of the larger amount of the tissue of the prostate. It's the durability of this surgery, if it's done properly, is very, very long compared to other surgeries. And the cons, of course, we talked about the risk for infection, but the most common problem with it, in up to 85%, is what we call retrograde ejaculation, that the ejaculation of the semen will go back to the bladder and not going out.
Mm-hmm. Okay. So there has been a question. I've heard this as well, that after peeing, you should press the area between the rectum and testes to empty out completely. Is that correct?
Yeah, it can help in some patients who are experiencing that they are not emptying, or some post-dribbling. It can help them, yes.
Okay, so that is something that you would recommend.
Yeah, for those who are experiencing problem.
Is there any relation between hypothyroidism and BPH?
Actually not.
No link whatsoever. Okay. I think we've covered. We've got a few minutes left if anybody else wants to add their questions. I think what's been positive today for me is I agree with you that men, especially older generation, tend not to talk about these things. So I think what's been positive is the number of questions that's been asked today. So I think it's something that Cigna we should continue to do, is to focus specifically on men's health, because I agree with you, the more you can talk about these things, the less of a taboo they become, and more likely people are to go and get tested. Oh,
I can add something, because I didn't mention any data from the Middle East or Africa, because actually there is a lack of proper registry for things in order to reveal, and this is one of the challenges that we have, because if we want to build up or improve something, we should have a data registry, a proper data registry for the population, to find out, to know the numbers, and then try to improve things.
so is that something that exists in other countries, but not so much in the Middle East or Africa?
It is more well developed in Europe and the United States, and in some Asian countries, but it's underdeveloped in the Middle East and Africa.
Mm-hmm. Do you see that changing for the future?
Well, I hope so. There is many ideas to change this, but this is very important, because we need to know how much is the incidence of different diseases, because I think, at least for the prostate cancer, it is under-detected in the region compared to Europe, and this is why many patients presenting with a late stage.
Mm-hmm. We always say you can't manage what you do not measure, so I agree with you that getting those stats to be able to kind of look at the overall problem and see how much of an issue it is super important. Okay, well, thank you very much, Dr. Madar. It's been great having you join us. Thank you for your presentation and for managing all those questions. Well, thank you very much. Thanks everyone for joining. We will be sending an email to ask you for your feedback. We'll be providing a recording for you to listen again if you want to. And we'll also be taking suggestions for future topics. So if there's anything that you would like us to cover, please let us know. So thank you very much, Doctor. Thanks for everyone for joining, and stay safe. Thank you.
Thank you.